who is standing by, I think, at the Charlotte Maxeke Hospital. Over to you, Samkele.
Yes, we are indeed here at the Charlotte Maxeke Hospital, where President Cyril Ramaphosa is here alongside the Premier of Gauteng, David Makhura, and the MEC of Health, Dr. Samkele Maseko. You remember our own colleague, Griselda Lewis, was here at this particular hospital and had that exclusive story where they were showing her and illustrating to her how COVID-19 positive patients will be treated at this particular hospital. I'm going to bring in Mr. Vuyo Mahaka, the spokesperson of Premier David Makhura. Mr. Mahaka, the essence of bringing President Cyril Ramaphosa at this particular hospital, what does it signify?
Well, it signifies, one, to show the President the state of readiness of Gauteng. As we have always said, that we are preparing for the worst and hoping for the best. So we actually, as you have seen in Nazareth, we have literally built a new hospital. Out of that thing, the President went to the food bank just to show those people who could not, who were actually getting food but could not get the food now, were able to provide them food on a daily basis. Homeless people, who are about 3,000 in Gauteng, are provided food. Now we're at Charlotte Maxeke just to show the state of readiness of Gauteng to actually, if this epidemic goes south, the Gauteng is actually ready to respond.
Mr. Mahaka, Gauteng is seen as one of the epicenters of this particular pandemic. Just yesterday, you're overtaken by about 30 people to the number one spot, with the Western Cape now having the highest numbers of this particular pandemic. What is Gauteng doing in order to try to curb this particular spread of this virus, looking especially that the economy is about to be opened up in different phases now?
Well, you'll understand that in Gauteng, in all its 5 regions, the major area that concerns us is Johannesburg, Ekurhuleni. We have actually trained tracers. The tracers that have been there during the HIV, AIDS people, so those tracers have been retrained to start looking for people, what do you call the contacts, the people that have been in contact with those who are positive. So if you look at the numbers of Gauteng, although that we're still number one, but they're actually quite stabilized around the 20s, 30s, and actually shows the work that has been done to go and look for people who are COVID positive. Tshwane is starting to stabilize. Citybang is almost starting to be declared COVID-free area, as well as Westland. So the work is being done so that we don't necessarily bring people to the areas, but we actually sending the healthcare workers to make sure that we look and found those people who are actually COVID positive or who will have actually contacted with those people.
In short, Mr. Mahaka, how many people have been screened for the COVID-19 across Gauteng thus far?
It's about 924,000, so we're closer to 1 million. The people that we have screened, and we have tested about 8,500 thereabout. So the work is being done. So we're screening a lot of people, and a lot of people are actually being tested.
How many people are currently in hospital of this particular pandemic? We saw a slide by Premier David Makhura earlier on in the morning.
Well, the number, I think, is about 50 or so, but it's divided between the public sector as well as the private sector.
Thank you very much, Mr. Mahaka. In fact, those numbers are stating that there are 58 patients currently in hospital in Gauteng. Premier David Makhura saying that 40 of those are currently in private facilities and 18 are currently in public facilities. When the president comes out of this particular briefing that he's receiving inside Charlotte Maxeke, he is expected to brief the nation on a few issues that have translated in this particular visit he has embarked on to see the work that Gauteng is doing to try and combat the spread of this particular pandemic, COVID-19, and to try and also quiz him on his address to the nation last night when he spoke about the easing down of the regulations of COVID-19, leaving from level 5 of the COVID-19 that government has implemented, going up onto stage 4, which will be implemented as of the 1st of May. But we'll definitely ask him on those domestic questions and a few international questions, such as his all-important teleconference meeting with the President of the United States of America, Donald Trump. And did he raise concerns with how Trump, the President of America, has opted to withdraw funding to the World Health Organization, and how Dr. Tedros, the Director General of the World Health Organization, has been receiving certain attacks, and he himself has called for unity of world leaders, saying it's not the time to politic over this COVID-19 virus.
Thanks very much, Samkele, for your report. My colleague there, Samkele Maseko.